Have you ever been sitting with your dog, just quietly petting them the way you do 1,000 times without thinking about it, and your hand stopped? Not because you decided to stop. Because your fingers found something. Something small. Something raised. Something that was not there before, or at least not there the last time you ran your hand along that exact spot. And in the half-second between your fingers finding it, and your brain registering what your fingers found, everything was still fine. And then your brain caught up. You pressed it gently. It was soft. Or maybe firm. It moved when you touched it, or maybe it did not move at all. You pushed your dog's fur aside to look at it directly, and there it was. A lump. Sitting on your dog's body like it had always been there. Completely indifferent to the storm it just set off inside you. You called your dog's name. They looked up at you with those eyes. Completely unbothered. Tail doing its slow, steady wag. Entirely unaware that in the space of 3 seconds, while you were simply sitting there petting them, your entire emotional world shifted. And what came next, if you are honest with yourself, was not a calm, rational sequence of logical thoughts. It was a wave. Fear first. Then that specific, suffocating version of love that only comes when you realize something you cannot live without might be in danger. Then the internet. The frantic, 2 a.m. search that filled your screen with words like tumor and malignant and survival rates and staging, and you had to put the phone down because you could not breathe properly. You looked at your dog sleeping. Still peaceful. Still completely fine. And you sat with a fear so large it had no edges. Here is what I need you to hear right now before anything else. Most lumps found on dogs are not cancer. The majority of lumps that dog owners discover during everyday petting are benign. They are fatty deposits, cysts, skin tags, warts, and fluid-filled sacs that pose no threat to your dog's life whatsoever. But I also need to tell you the other truth. Some lumps are serious. And the difference between a lump that is nothing and a lump that is something is not determined by how it feels under your fingers or how it looks to your eyes. It is determined by 3 specific questions. Questions that every dog owner needs to know before they either catastrophize unnecessarily or dismiss something that deserves urgent attention. Hello everyone. I am Dr. Caroline West, and welcome back to Paw Secrets Lab. I have spent over 16 years in veterinary oncology and internal medicine. Lumps, masses, and growths on dogs are something I have evaluated clinically thousands of times. And the single most consistent thing I observe is this. Dog owners who find a lump on their pet fall into one of 2 groups. Those who catastrophize immediately and spend weeks in paralyzed terror before getting the lump properly assessed. And those who minimize it, decide it is probably nothing, and wait months or sometimes years before bringing it to a veterinarian. Both responses are completely understandable. And both responses can lead to outcomes that proper early assessment would have prevented. What if I told you that there is a precise, 3-question framework used by veterinary oncologists that immediately stratifies any lump into a clear category of urgency? Not a definitive diagnosis. No framework replaces proper veterinary assessment and diagnostic testing, but a structured set of observations that tells you clearly whether you are dealing with something that can wait for a scheduled appointment next week, something that needs to be seen within the next few days, or something that requires you to call your veterinarian this morning. Today at Paw Secrets Lab, we are going to walk through that framework completely. Here is exactly what we are covering. In Chapter 1, I am going to explain the lump landscape. You are going to understand the actual statistical reality of lumps in dogs, the most common types, and why the feel and appearance of a lump under your fingers is a far less reliable indicator than most owners believe. In Chapter 2, I am going to teach you the 3 questions. This is the complete oncological triage framework adapted for home use that tells you precisely how urgently any lump needs veterinary attention. In Chapter 3, I am going to walk you through the home documentation protocol. This is the specific system for recording everything about a lump that makes your veterinary appointment exponentially more productive, and gives your vet the information they need to act decisively. And in Chapter 4, I will give you the non-negotiable warning signs that bypass all frameworks and require immediate veterinary attention today. Subscribe to Paw Secrets Lab right now and join our extraordinary, growing community of educated, empowered pet parents. Get something to write with. This framework is going to replace fear with clarity. Let us begin. Welcome to Chapter 1. The Lump Landscape. Before we apply any assessment framework to a lump you have found, you need to understand the actual landscape of lumps in dogs. Because the fear response that finding a lump triggers is almost always calibrated incorrectly. Either dramatically too high or dangerously too low. And calibrating it accurately requires understanding what lumps in dogs actually are, statistically and biologically. Dogs develop lumps at a significantly higher rate than most other companion animals. This is partly genetic, partly related to the extraordinary diversity of dog breeds and their associated genetic predispositions, and partly simply a feature of the canine immune system and skin biology. A study published in the journal Veterinary and Comparative Oncology found that approximately 1 in 4 dogs will develop a tumor of some kind during their lifetime. That sounds alarming until you understand the next piece of data. The vast majority of those tumors are benign, non-cancerous, biologically inert growths that will never spread, never invade surrounding tissue, and never threaten your dog's life. Let me walk you through the most common types of lumps that dog owners find during routine petting so you understand the landscape you are navigating. The most commonly found lump in dogs, particularly in middle-aged and older dogs, is the lipoma. A lipoma is a benign fatty tumor that develops in the subcutaneous tissue, the layer of fat just beneath the skin. Lipomas are extraordinarily common in dogs. They feel soft and doughy under the fingers. They move freely when you push them. They are not attached to the underlying muscle or tissue. They grow slowly over months and years. And the overwhelming majority of them are completely harmless. Certain breeds have a particular genetic predisposition to developing multiple lipomas throughout their lifetime, including Labrador Retrievers, Doberman Pinschers, and miniature Schnauzers. The second most commonly found lump is the sebaceous cyst. Sebaceous glands in the skin produce the oils that keep your dog's coat healthy and the skin barrier intact. When a sebaceous gland becomes blocked, the secretion accumulates and forms a cyst. These feel like a firm, round, well-defined bump just beneath the skin's surface. They may have a small opening at the top. They sometimes rupture and release a thick, white or yellowish, waxy material. They are not cancerous. They are not dangerous. But they can become infected if they rupture in a contaminated environment, and that infection requires veterinary treatment. The third common lump type is the histiocytoma. This is a benign skin tumor that occurs almost exclusively in young dogs, typically under 3 years of age. Histiocytomas appear suddenly, grow quickly over days to a week or two, look red and raised and slightly inflamed, and alarm owners enormously because of their rapid appearance and angry presentation. But histiocytomas have a remarkable biological characteristic. The overwhelming majority of them resolve completely on their own within 1 to 3 months as the dog's immune system eliminates them without any intervention. The fourth type worth knowing is the wart, or viral papilloma. These appear as small, rough, cauliflower-textured growths on the skin or around the mouth and lips, particularly in young dogs or immunocompromised older dogs. They are caused by the canine papillomavirus. They are benign. They typically resolve spontaneously. And they are important primarily because they indicate a degree of immune system activity that is worth monitoring rather than treating in most cases. Now here is the critical limitation of everything I have just described. Every single one of those benign lump types has a malignant counterpart that can look and feel nearly identical to the naked eye and the untrained hand. A liposarcoma can feel almost exactly like a lipoma. A mast cell tumor, which is one of the most common malignant skin tumors in dogs, can look like almost anything. A small, soft, slow-growing, harmless-appearing bump. A rapidly growing, ulcerated, angry mass. Or anything in between. Mast cell tumors are the great imitators of the canine skin tumor world. They mimic benign growths so convincingly that even experienced veterinarians cannot distinguish them by visual examination and palpation alone. This is precisely why the feel of a lump is not a reliable indicator of its biological nature. And precisely why the 3 questions matter. Welcome to Chapter 2. The 3 questions. This framework does not diagnose your dog's lump. Nothing you can do at home diagnoses a lump. Diagnosis requires cytology, which is the microscopic examination of cells collected from the lump, or histopathology, which is the examination of a tissue sample. These are veterinary procedures. They are irreplaceable. And they are the only way to know with certainty what any lump is. What these 3 questions do is give you a structured, evidence-based urgency assessment that tells you how quickly your dog needs to be seen. They replace the chaotic, fear-driven decision-making that finds a lump on Tuesday and spends the entire week in terror, or alternatively finds a lump and convinces itself it is nothing for 6 months. Ask these 3 questions in order. Write down your answers. Bring those answers to your veterinary appointment. Question 1. How fast is it growing? This is the single most clinically significant question you can ask about any lump. Growth rate is the most reliable behavioral indicator of a lump's biological nature available to a home observer. Not its size. Not its feel. Not its location. Its growth rate. Here is how to assess growth rate accurately. When you first find a lump, do not try to estimate its size with your fingers. Take a photograph of the area with your phone camera, parting the fur to expose the lump clearly. Then take a clean piece of clear tape and press it gently over the lump, pressing firmly enough that the outline of the lump is faintly visible on the tape from the raised edges. Stick that piece of tape onto a white piece of paper and trace the outline with a pen. Write today's date beside the outline. This is your baseline measurement. Repeat this process every 7 days for the first month. A lump that shows no measurable change in outline over 4 weeks of weekly tracing is behaving like a benign growth. This does not make it definitively benign, but it tells you its behavior is consistent with the slow-growing category. A lump that shows visible, measurable growth between one weekly tracing and the next is a lump that demands a veterinary appointment this week. Not next month. Not when it is convenient. This week. Rapid growth is the most consistent behavioral characteristic of malignant tumors. Not universal. Not definitive. But the correlation is strong enough that rapid growth in a lump should always be treated as urgent until proven otherwise. A lump that doubles in visible size within 2 to 3 weeks is a veterinary emergency. Call your veterinarian today. Question 2. Where is it located? Location on the body is the second most important piece of information about any lump because location directly determines which tissue types the lump can originate from, and certain locations carry dramatically higher malignancy rates than others. Here are the locations that elevate urgency regardless of how a lump looks or feels. Lumps located in the space between the toes, the interdigital space, carry a significantly elevated risk of malignancy compared to lumps elsewhere on the body. Subungual masses, lumps that appear to originate beneath or around a nail, have an extremely high rate of being aggressive malignant tumors in dogs and require prompt veterinary assessment without exception. Lumps located on the eyelid margins, inside the mouth, on the gums, or on the lips require early assessment because the tissue types in these areas include several that have high malignant transformation rates, and because early intervention in oral tumors specifically makes an enormous difference to outcome. Lumps located in the mammary gland tissue of unspayed female dogs, which runs in 2 parallel chains from the chest down to the groin, carry a 50% malignancy rate. 1 in 2 mammary lumps in unspayed female dogs is malignant. This is one of the most important statistics in all of canine oncology. Any new lump in the mammary chain of an unspayed female requires veterinary assessment within days, not weeks. Lumps that appear to be growing from beneath the skin, attached to deeper tissue or muscle rather than moving freely in the subcutaneous layer, are significantly more concerning than freely movable lumps regardless of their location. Deep attachment suggests involvement of tissue layers that benign lipomas do not typically invade. Question 3. Is the lump changing the dog? The third question shifts focus entirely from the lump itself to the dog carrying it. Because a lump that is affecting your dog's behavior, comfort, or systemic health is telling you something critical about its biological activity. Ask yourself these specific sub-questions. Has your dog begun licking, chewing, or scratching at the lump? Repetitive self-trauma to a lump indicates it is causing discomfort, which in turn indicates it has biological activity beyond passive existence. Is your dog flinching or pulling away when you touch the lump or the area around it? Pain in a lump is not a definitive indicator of malignancy, but it is an indicator of active biological process that needs assessment. Has your dog's overall energy, appetite, or behavior changed since you first noticed the lump? Systemic changes alongside a new lump, lethargy, reduced appetite, weight loss, changes in gait, can indicate that the lump has biological reach beyond its visible borders. Is the lump's surface intact, or is it ulcerated, bleeding, weeping fluid, or crusted? Surface breakdown in a lump indicates it has outgrown its blood supply or that its cells are biologically active in ways that benign growths typically are not. If the answer to any of these sub-questions is yes, the urgency level for veterinary assessment increases immediately regardless of the answers to questions 1 and 2. Welcome to Chapter 3. The Home Documentation Protocol. You have asked the 3 questions. You have your answers. Now I am going to give you the specific documentation system that transforms those answers into actionable veterinary information and makes your appointment dramatically more productive from the first minute. Veterinarians make better diagnostic decisions when they have complete information presented clearly. The average veterinary appointment is 12 to 15 minutes long. Every minute you spend recreating information from memory is a minute not spent on examination and clinical reasoning. The documentation protocol I am about to give you eliminates that waste and gives your veterinarian what they need immediately. Documentation Step 1. The Photograph Series. Take a minimum of 4 photographs of the lump today. A wide shot showing the lump's location on the body in context. A close-up shot with the fur fully parted showing the lump surface directly. A photograph with a ruler or coin placed beside the lump for scale reference. And if the lump is 3-dimensional and raised, a side-angle photograph showing its height profile. Store these photographs in a dedicated album on your phone labeled with your dog's name and today's date. Add new photographs every 7 days. Documentation Step 2. The Measurement Record. Using the tape tracing method I described in question 1, create your dated baseline outline today. Store the traced paper in a safe place and repeat the tracing weekly. Bring the complete sequence of dated tracings to your veterinary appointment. This gives your veterinarian a visual growth rate record that is infinitely more informative than, "I think it might be bigger than last week." Documentation Step 3. The Lump Profile Card. Take a piece of paper and create a simple written record with the following information. The date you first noticed the lump. Your best estimate of whether it was present before that date or appeared suddenly. The precise location on the body using anatomical landmarks, not just on the back, but specifically 2 inches to the left of the spine, approximately level with the last rib. Whether the lump moves freely when you press it sideways or feels fixed to underlying tissue. Whether the surface is smooth, irregular, rough, or ulcerated. Whether it is soft and doughy, firm and rubbery, or hard. Whether your dog reacts when you touch it. And your answers to all 3 triage questions with specific observations. This written profile takes 7 minutes to create and reduces the diagnostic uncertainty in your veterinary appointment significantly. Documentation Step 4. The Behavioral Change Timeline. Write down every behavioral or physical change you have observed in your dog since noticing the lump, with approximate dates. Reduced energy. Any change in appetite. Any new reluctance to exercise or use stairs. Any changes in sleep. Any digestive changes. Any changes in gait. Include only genuine observations, not fears or hypotheticals. Your observations are clinical data and your veterinarian will use them. Documentation Step 5. The History Summary. If your dog has had any previous lumps assessed by a veterinarian, write down the date, location, and diagnosis of each one. Previous lump history is clinically relevant. Certain lump types have recurrence patterns. Certain breeds have specific tumor type predispositions. And a dog that has previously had a malignant tumor assessed has a different statistical risk profile for new lumps than a dog with no previous lump history. Bring all 5 documentation elements to your veterinary appointment in a clear, organized format. Your veterinarian will notice. And the quality of the diagnostic conversation you have will reflect the quality of the information you bring. Welcome to Chapter 4. When a lump cannot wait. The 3-question framework and the documentation protocol are designed for lumps that allow time for systematic observation and a scheduled veterinary appointment. There are specific presentations that bypass the framework entirely and require you to contact your veterinarian or an emergency clinic today. If the lump appeared suddenly, literally overnight or within 24 hours, and is already large, larger than a grape, a sudden large mass appearing with that speed is not a benign growth. Benign growths grow slowly. A large mass that appears suddenly suggests a hematoma from internal bleeding, a rapidly proliferating malignant tumor, or an abscess from infection, all of which require same-day assessment. If the lump is bleeding actively, seeping blood or other fluid continuously, or if the surface has broken down into an open wound, please do not apply home remedies and monitor. Wrap the area loosely with clean gauze to reduce contamination and go to your veterinarian today. Open, actively changing lump surfaces are exposed to environmental bacteria and require professional wound assessment and management. If the lump is in your dog's mouth and your dog is having difficulty eating, swallowing, or breathing, this is an emergency. Oral masses that interfere with airway or swallowing function are immediately life-threatening regardless of their biological nature. Go directly to an emergency veterinary clinic. If your dog has a lump on or between the toes and has simultaneously become lame on that leg, the combination of toe lump and lameness significantly elevates the probability of an aggressive bone-associated tumor. Bone tumors in the distal limb are among the most painful conditions in veterinary medicine. Your dog is in significant pain and needs assessment today. If you find multiple new lumps appearing across your dog's body simultaneously rather than a single isolated lump, multiple simultaneous new growths suggest a systemic process rather than a local one. This pattern requires urgent blood work and comprehensive evaluation. And if your dog is showing any signs of systemic collapse alongside a new lump, profound weakness, pale gums, rapid breathing, visible distress, a ruptured tumor causing internal bleeding is a possibility that constitutes a critical emergency. Go immediately. You came here today in the aftermath of a moment that stopped your hand mid-stroke while petting your dog. A moment that sent you from complete peace to complete fear in the space of 3 seconds. And instead of staying in that fear, instead of spending another night with your phone screen filling with survival rates and staging systems and worst-case scenarios, you came here and you asked for a framework. That is one of the most rational, most loving things you can do for your dog in a frightening moment. Fear is not useful to your dog right now. What is useful is the tape and the pen creating a dated baseline outline. The photograph series with the coin for scale. The lump profile card with precise anatomical location and surface characteristics. The behavioral change timeline with specific dates. The 3 questions answered clearly and honestly. That information is what your veterinarian needs. That information is what turns a terrifying unknown into a managed clinical question with a clear pathway forward. And you are the one who can gather it. Not because you have medical training, but because you were there when your hand stopped. You know exactly where it is. You can photograph it and measure it and describe it and document it in ways that transform a 12-minute veterinary appointment into a genuinely productive diagnostic conversation. Your dog does not know there is a lump. They are not afraid. They are not lying awake running statistics in their head. They are sleeping with the complete, uncomplicated trust of an animal who knows that the person whose hand found that lump is the same person who feeds them and walks them and knows their face better than anyone else on earth. They trust you to handle this. And you are handling it. Most lumps are nothing. Hold on to that truth. And take the next step clearly, calmly, and with the specific information that gives your dog the best possible veterinary outcome whatever the lump turns out to be. Tell me in the comments below. Where on your dog's body did you find the lump? How did it feel under your fingers? And after applying the 3 questions tonight, which urgency category does your dog fall into? Your experience is not just your own. Every parent reading these comments tonight, hand still trembling slightly, needs to know that others have been exactly where they are and found their way through it with a clear framework rather than paralyzing fear. If this masterclass replaced even a fraction of your fear with clarity and a clear next step, please tap the like button. It tells the YouTube algorithm that specific, honest, fear-replacing veterinary education deserves to reach every dog owner who finds a lump tonight and reaches for their phone in the dark. Subscribe to Paw Secrets Lab and join our incredible, compassionate community of educated pet parents who face the hard moments with knowledge rather than panic. I am Dr. Caroline West. Get that tape and pen tonight. Take those 4 photographs. Create that lump profile card. And call your veterinarian tomorrow morning with the most complete, organized, useful clinical picture any dog owner has ever walked into an appointment with. Your dog trusted your hand to find it. Trust yourself to know what to do next. I will see you in the very next video.